Hey guys, welcome to my channel. My name is Liz and today's video is going to be all about post-op care. Hopefully by the time this video gets out, this first video all about pre-op care would be out. So for those of you who don't know, I will be having bariatric surgery, specifically the gastric sleeve, where they cut away 80% of my stomach and leave me with like a little banana peel, the remaining 20% of the stomach, obviously. So today is August 25th and I had my 4-hour nutrition course. So 2 hours spent with a nutritionist. It was like a group Zoom meeting with other patients as well. And then for the about hour and the remaining hour and a half, we spoke with the nurse that we may or may not see during our hospital stay, depending on her shift, obviously. I'm not gonna lie to you, it was overwhelming to the point where it's just, not that it put me in a damper mood, but it's life-changing, obviously, and it's not just like a short 2-week period. It's for the rest of your life. You're going to be on vitamins for the rest of your life. You're going to have portion control, obviously, because you can stretch out your stomach, you can gain the weight back, and nobody wants to do that. Nobody wants to go through this whole process just to gain all the weight back. Obviously, it's a long process. And for those of you who are judging and saying, oh, it's a shortcut, it's really not. And if you didn't watch my first video, all the pre-op testing stuff that you need to do, go watch that. I normally don't recommend people to, watch all my videos. Child, I do not care. But just go. Just watch the video and see the amount of clearances that need to take place just to get approved for this surgery. It was a lot. And then it just, not that it just keeps getting harder, it's more things. And I wish I would have known more of this information, not 2 days prior to my surgery. I'm going to go through all of them, but again, I'm not posting this video for people to be like, oh yeah, that's what I should do, If you're working with a whole team, a surgeon team, if this is the route you're going, stick with what your nutritionist is telling you. Obviously, I do not need to put in this disclaimer, but I feel like it needs to be said. Stick with what your primary care physician is saying. With whatever your team, if you're working with a team, go by those restrictions and guidelines, obviously, because mine is going to be completely different. I don't know. It's all going to vary, but again, stick with what your nutritionist and your doctor and your surgeon and all the other people on this team working with you to help you try to lose weight. If you choose to go with the gastric sleeve, there's another one that went over with the gastric bypass. That's a little bit more intensive. Different variations of vitamins and medications. I obviously am not well versed. I'm not a nutritionist. This is just what they told me and the information I'm absorbing, and it's overwhelming. But I would have wanted someone to tell me this weeks prior, because it takes weeks of preparation. Honestly, you have to stop your birth control a month in advance. You cannot take your birth control, oral contraceptive, or rather, you can have the IUD and the Nexaplan, and that can stay in. You don't have to run and take it out, but the oral contraceptives have to stop. If you're taking any blood pressure medications, that has to be monitored. So if you're a diabetic, that's also a factor. There's a lot of things prior to surgery that you have to go through, and after surgery. Like, you can't fly for 6 weeks. You can't have alcohol for 4 months. Some people say 3 to 6 months, depending on your surgery. If it's a gastric sleeve, it's 4 months. If it's a gastric bypass, it's 6 months. You can't submerge your incisions. Obviously, if it's going laparoscopic, there's going to be like 6 or so incisions in your stomach. You can't use lotion prior to surgery because obviously they're going in there. So I'm going to go through all of that. This is just a quick little intro into what I'm going to be discussing. So prior to surgery, obviously my diet has been primarily liquid diet, like 2 protein shakes, breakfast and lunch, and my big water jug over here is 64 ounces of water. I just chug it. At this point, I just chug it. Water is water. They do have other recommendations like vitamin zero water you can drink, hint water. There's, they tried to wean me off of obviously carbonated beverages, because once you have surgery, you cannot have any carbonated beverages because it will stretch out your stomach. Some people have said it's painful for them to drink carbonated beverages. Some people are completely unaffected at all and they continue to drink carbonated beverages, and then their stomach is going to stretch out and they're going to come in for revision for surgery. You just don't want to go through that. So I mean, my sister calls it miracle water. I love my sparkling ice, specifically the pineapple one, black cherry, black raspberry. I love it. 2 days prior to surgery, it is a all liquid diet. So my surgery's on Monday, so Saturday it's all liquid. So I'm going to have 3 protein shakes. So my protein shakes are the Ensure Max Protein, so you have to have 30 grams of protein per shake. So they want you to have 60 grams of protein every day after surgery. So pretty much you're going to be sticking to an all liquid diet 2 weeks after your surgery, and pretty much 2 of these a day. And then the 3rd week you're going to slowly start introducing proteins: chicken, ground beef, ground turkey, ricotta cheese, things like that. You will start introducing in your 3rd week. But again, 2 days prior to surgery, all liquid diet. So my surgery is on a Monday, so Saturday is going to be all liquid diet, so 3 of these protein shakes, and then Sunday it's clear liquids, so apple juice, white cranberry, white grape. So you're not supposed to drink anything 30 minutes after you eat. Obviously you're on a liquid diet, but technically that's your meal. So you can do the protein, the powdered shakes where you mix it, but I do not have time for that. I am 100% for convenience, so I am not even going to dabble into mixing the protein shakes myself. I could care less. But there are different protein powders that you can use, and you can also mix in the peanut butter protein powder, where it's PB2 or something like that, if you really choose to. Even again, when you're mixing in the shakes, the protein powders for the shakes, you can't have any fruit solids. Obviously, even if you puree a banana, like, you can't have any solid like fruits or vegetables. So you can only integrate that into your 3rd to 4th week after surgery. Once you start introducing your fruits and vegetables, you can have things like berries, plum, peaches, clementine. There is a stipulation with grapefruit, because if you're on like blood pressure medication, that could be a bad reaction. Kiwi, cherries, apple, pear, oranges, no fruit juices, dried fruit, or tropical fruits. So even with watermelon, my nutritionist said there's a lot of sugar in that. Okay, so the non-starchy vegetables you can have, I love asparagus, spinach, zucchini, cucumber, broccoli, cauliflower, tomato, lettuce, yellow squash, carrots, broccoli rabe, peppers. So with the protein shakes, you can mix in skim milk, lactate, if you're concerned for lactose. You can use lactate milk, soy milk, almond milk, but you can't have any caffeinated beverages after surgery. You can have caffeine a little bit prior to surgery, but after surgery you cannot have any caffeinated beverages. So you can do decaf tea, decaf coffee, but everything's pretty much sugar-free. So sugar-free pudding, sugar-free jello, sugar-free popsicle sticks. So you can't have any red or purple liquids prior to surgery, because that could be confused as like blood, like you're bleeding. So you're going to need liquid measuring cups, dry measuring cups, measuring spoons, a food scale, because you're going to have to measure everything. Obviously, you know, you're going to have 3 to 4 ounces of protein, and you can't eyeball that. I mean, after a while you can, but just to be exact, my Virgo in me, I do want to be exact as possible. So the multivitamins that you have to take. So I'm going to go over the sleeve and the bypass quickly. For the sleeve, 100% zinc, 100% biotin, 18 milligrams of iron, vitamin B12, 350 to 500 micrograms, folic acid, 400 to 800 micrograms, folic acid for women, 800 to 1,000 women of childbearing age, so me, until you're 40 pretty much, until you hit menopause, 800 to 1,000 micrograms. So for the bypass, it's a little bit more. Okay, so the folic acid, the vitamin B12, the zinc, biotin is the same. The only difference for the bypass is the vitamin A, 10,000 IUs or 3,000 micrograms, and for men, 30 to 35 milligrams of iron, and for menstruating females, 60 to 65 milligrams. So as far as vitamins, so they have to be capsules, chewables, liquids, or soft chews. So basically no tablets. You cannot have tablets. You can't have tablet like vitamins. You can have tablets for 3 months after your surgery, and that's specifically for the sleeve. For the bypass, it's 6 months after your surgery. You can't have any tablets. So while you're in the hospital, they're not going to have you taking any vitamins. While you're in the hospital, the day after, like after they perform your surgery, you're only going to be sucking on or chewing on crushed ice pretty much. They said you can't let it melt and just drink the water. They want you to suck on and chew on the crushed ice. They really stress walking as much as possible, frequently, preventing blood clots, and they give you an incentive spirometer. I'll pick up a picture. I'll pull up a picture. And then you also have to have your calcium. You can't have them together, so you have to have calcium citrate. I can't remember the milligrams for calcium. I think it's like 600 or something, 500, 600, but these are 300 milligrams. You have to take 2 of them. So you can't have your vitamins, multivitamins with your calcium, so 1 for lunch, 1 for dinner. So after surgery the first day, you should be discharged the next day at evening time or after 6. So you go through your surgery, sucking on ice chips, and the next day you have to focus on drinking fluids, or trying to get fluids, so apple juice, jello. Here on out, after surgery, sip, 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 because you can't chug anymore. You're gonna hurt yourself, okay? Don't chug. I chug, but you can't chug anymore. Recommended for everyone, pretty much, not even just after bariatric surgery, but 60 to 64 ounces of water a day. Again, that can include vitamin zero, that can include hint water, just 60 to 64 ounces of fluid ounces of water, pretty much, on top of your 2 protein shakes. You can eat seafood as well if you want. They said sometimes salmon, some patients have struggled with salmon, so whitefish, tilapia, scallops, flounder, shrimp, swordfish, tuna. They said not. Some patients take maybe a month to adjust to red meats like ground beef, but you can have chicken, turkey, pound, or what have you, eggs. So after a month, that's when you start incorporating the fruits and vegetables, still with your main protein, and then just a couple ounces of like cauliflower. I think it's like 3/4 of a cup of like cauliflower, or I'll go through the approved vegetables, because you can't have starchy vegetables. You can't have like sweet potatoes, corn, because again, that'll slow down your weight loss. And again, you can't have any carbs. They don't really want to introduce carbs, rice, pasta. Okay, so about 1 month post-op, it's a regular diet. So since your diet now primarily consists of protein, it doesn't include fiber. So a big concern is constipation. So they said if you don't have a bowel movement every other day, that is a cause for concern. Obviously, the signs for infections, redness, fevers, shortness of breath, stuff like that is all concerning, but primarily constipation is one of the concerns. So basically, you're going to be on 17 grams packet. You're going to be on Miralax and Gastric as needed, but you're going to need it probably. In order to perform the surgery, they're going to pump your stomach with gas to fill up your stomach so they can go in and do what they need to do, right? So the reason why they want you to walk is to get rid of that gas, because that's going to be the point of contention of pain. So they do recommend Gas-X, but again, for the constipation reason, they're going to give you Miralax. Sorry, that was my dog. Miralax, so 17-gram packets and 8 ounces of water, 2 to 4 ounces daily. In addition to that, they're going to want you on Pepsid, which just means famotidine. Take 3 months, 20 milligram tablets twice a day. Extra strength Tylenol, 1,000 milligrams every 6 hours for 3 days. If you have breakthrough pain, they do provide Celebrax, 200 milligram capsules every 12 hours. Zofran, and that's if you have nausea, 44 milligrams every 8 hours. Uridisil, and that's if you still have a gallbladder, because this could cause gallstones, and unless you want your gallbladder removed, they recommend you taking this medication. 300 milligrams twice a day for 6 months. This is where I'm saying this is not a bada bang kind of thing. This takes time, and it's not like, oh, you get your surgery. No, you have a 2-week follow-up. You have a 4-week follow-up. You have a 5-week. There's still a lot of follow-up, and every year after, you're gonna need a follow-up. So it's the 2-week after surgery. It's the 4 to 5 week nutrition course after your surgery. 3 months, 6 months, 9 months, and then 12 months, and then after that, every year. The Colace, again, prevent constipation, 100 milligrams once daily. So like I was saying, they want you to take a Dualax 5 milligram laxative 2 nights before your surgery. So mine is going to be Saturday night. So you have to pat dry your incisions, no rubbing, no washcloths. So they said you can resume sexual activity as soon as your surgeon clears you. Like I said, birth control, stop taking it a month prior and a month after, and you cannot get pregnant. Absolutely not. You can, but you're not supposed to, and it's a high risk for you and your baby. So avoid pregnancies 1 1.5 years after surgery. You cannot drive 5 to 7 days after surgery. Someone has to take you home, someone has to drop you off, someone has to take you home. So there's a few medications listed that you have to stop. If you have hypertension or your blood pressure is a concern for you, you have to take it 4 times a day, 8 a.m., noon, 6, bedtime, and they give you a sheet to write it on. If you're diabetic, obviously you have to measure your blood glucose, again, 4 times a day. I was told once a day from the nurse, but then on the sheet it said 4 times a day, but it doesn't hurt. So I think I'll probably just take my blood glucose once a day. So I can have visitors, obviously the Rona, so they have to show proof of vaccination or negative testing 3 or 5 days prior to visiting you. I'm sorry if it felt like I was just reading a script a little bit too much, but again, a lot of information. Another thing was you cannot lift anything over 10 pounds, I think a week after surgery, and then anything over 20 pounds 2 weeks after surgery. So if you have little children, that could be a concern. You might need to call some reinforcements. You know, a little bit after your surgery, you can't bend over. If you're going to take any medications after surgery, they do recommend obviously speaking with your surgeon, because they're going to know what medications you'll be able to consume and not consume, and how it'll interact with your body. That's obviously not on the approved list or previously mentioned. So on this, it's going to say if you had a bowel movement or not, check it off. If you had your Lash or medications, and your vitamins and supplements, which is honestly very useful. Let me know in the comments where you're at in this whole process. Maybe why you're watching this video, what's your interest. Maybe it's just curiosity. Maybe you're deciding to go through with the surgery. Maybe you know you're about to go through the surgery and you want to know what to expect after surgery, because again, they told me 2 days before my surgery. Oh, another thing I forgot. So the second day after your surgery, they're going to have you take a swallow test to make sure there's not any leaks or anything. So you swallow liquid, they're going to have an x-ray and make sure there's no leaks coming out your incision. If you stuck to the end, I believe there's a little pound scale. Thank you so much for watching my channel. Like, comment, subscribe, because YouTube makes me say this. And yeah, bye.